driven by two main hormones, FSH and LH, follicular stimulant hormone, luteinizing hormone. Follicular stimulant hormone drives estrogen, luteinizing hormone drives testosterone. So the drive between these two hormones, for some reason, is impaired. And what normally happens in women, they have way more FSH than LH. So their luteinizing hormone is just kind of like a normal range. It spikes up for 24 hours to release the egg, which we need that LH release, the luteinizing hormone surge. It precedes ovulation. It determines ovulation. But if your LH is high all the time, it will drive testosterone. The increased drive of testosterone from the thecal cells inside your ovary will create a hyperandrogenic environment, too much testosterone, which will inhibit the ovulation. So the too much androgen becomes a downside to not enough estrogen. So not enough estrogen, too much testosterone, zero progesterone is really the hallmark of PCOS. Doing an ultrasound and looking at your ovaries on day 3 or 4 of your cycle would show how many antral follicles you have. These are the number of follicles that are you starting the cycle with, that the body is going to recruit that month, that cycle, that period of 4, 5, 6 weeks. And we can count those. And if you have 15 to 20 on each ovary, you most likely have PCOS. And then there's another test that we have now for PCOS that's shown to be highly reliable that is called the anti-Mullerian hormone. And that is a hormone that we typically have used to measure ovarian reserve. The anti-Mullerian hormone, AMH, if it's over 10 in a young woman, it shows a lot of eggs. Hey, it doesn't mean that you're highly fertile. It just means that you probably have PCOS and those eggs are not necessarily got recruited. They're not going to get recruited in the right way, ending into a fertility cycle. So these are the top 3 things you want to look for. You want to look at hormone levels. We want to look at the ultrasound. We want to look at the AMH level. And then obviously all of these 3 things are into the picture of what happens with your periods, what happens with your symptoms. Do you have acne, hirsutism, are you overweight, are you skinny, how are your periods coming, are you having signs of anovulation, are you having estrogen dominance, all of that. Do you have heavy crampy periods, they're spaced apart, sometimes they come late but they flood. All of these are typical signs and symptoms of anovulation and possible PCOS.